And so speaking of that, so how does one sign up for Medicare? So obviously you can go to a broker. The other question that I would have is, am I going to receive something in the mail pre my 65th birthday? How do I sign up for Medicare, and how will I be notified?
Right. Well, you won't be notified by Medicare. I mean, when you sign up for Medicare A and B, you have to go to Social Security Administration. The easiest way to do it is going to the website of either socialsecurity.gov, or you can go to medicare.gov and sign up that way. And you can go into their office, or you can give them a call, but online is probably the simplest way to do it, the most efficient. So the brokers are not involved with that process at all. Medicare will not even talk to brokers.
Okay.
They only want to talk to the person who's actually insured and all that.
So you have to first go and sign up directly through Social Security.
So you need to sign up for A and B, and then once you sign up for A and B, then you can either sign up for the supplemental plan and the drug plan, or you can sign up for Medicare Advantage. You have to have A and B even for Medicare Advantage. If you sign up for Medicare Advantage, you cannot drop your Part B premium. You still have to pay that $104.90 or whatever your number is.
Okay. And I do want to talk about the Medicare enrollment dates. This slide here talks about Medicare initial enrollment. So at the point that you're turning 65, you can sign up at least 3 months before or 3 months after.
Correct.
So you have about a 6-month window.
One thing about, if you're drawing Social Security checks already before you turn 65, they'll enroll you in Parts A and B automatically. So you don't have to enroll for A and B if you're drawing checks. So you're kind of in the system already. But if you're not drawing checks, you need to initiate it. I don't think you'll get a notice from Medicare saying you need to sign up. They don't work that way. So, and I a lot of times I call my clients and say about 3 months out, saying this is the time you need to start to get signed up for Medicare. And you can sign up if your birthday, say, is September. You can sign up to 3 months before your birthday month. You can sign up your birthday month, and you can sign up 3 months after your birthday month. Okay,
so you have that window.
Right.
And then what about the Medicare A and B, C and D, and then the Medigap plan? Touch on that briefly in terms of the Medicare open enrollment dates.
Okay. For Medicare, A and B we kind of talked about already. That's that 7-month window. If you miss your 7-month window, you can sign up for A and B during open enrollment, which is the first quarter of the following year, and it's effective July 1st of that year. I've had a couple people, like people on COBRA, Medicare isn't recognizing that as eligible waiver, so they say you missed your enrollment period, you have to wait until open enrollment, and then you get it July 1st.
Although, let me ask this, so if you're on COBRA, you miss your open enrollment plan, you have to wait. If your COBRA period ends, that would be a qualifying...
Not for Medicare, no.
Interesting. So you really do have to manage that if you're on COBRA and moving on to...
That's why you don't want to be on COBRA when you're over 65.
Okay.
You always want to get off COBRA.
Okay.
For Medicare C, which is Medicare Advantage plans, and D, the drug program, open enrollment is October 15th through December 7th. Okay. That's the same every year. So you're allowed to change your Part D plan. You can change your Medicare Advantage plan. You can go to Medicare Advantage from Medicare A and B and a drug plan. If you decide I want to go over to Kaiser or whatever Senior Advantage plan, you can do that at that time. So that allows you to do that. So Medigap, the more Medicare supplements, open enrollment is that 30-day birthday rule. Or there's other qualifying events too, like if you have a loss of coverage, you can sign up for a Medicare supplement, if you lose your group benefits and all that. So there are certain
But triggers. Not COBRA.
But COBRA actually, yes.
Okay.
But you're already in A and B to do that. So the issue is if you're not signed up for Medicare A and B, the COBRA is a problem. And it's not so much getting the supplemental plan, it's getting A and B.
Got it. And I'm just taking a peek here. We do have some questions from the audience, and while I take a look at those, this is an important piece here. If you're on a Medicare plan, especially Part D, do you need to make changes during open enrollment, and how might you do that?
You don't have to. If you choose not to change it, it'll roll over unless the carrier sends you a notice start of September that the plan you're on is being eliminated. Then they'll move you to another plan if you do nothing. So you won't lose coverage, but you may get moved to a different program than what you started with. But if you're on Medicare D, what I do is clients give me their prescriptions. I put them into Medicare's website, and it runs all 34 plans that are available in California best plan to worst plan in terms of costs and all that. So that's kind of saved in the Medicare site. So you can actually go in, and there's a password, and so you can go and change your prescriptions as appropriate for the following year. So like the plan information for 2015 will be out as of October 1st. So people can go in and open up, or they can send me their information. I'll go there and we'll change the drug data in the site, and then it runs the 34 plans or whatever for next year and what's best to worst. And if it's still a good plan you're on, we don't do anything. If you've had a significant change on your prescriptions, or the drug plan changed the plan significantly that adversely affected some of the drugs you're on, then you might want to change them. So it's prudent probably to evaluate the Part D plan. Some of Medicare supplements, they're pretty similar to all the carriers, because like Plan F is the same with all the carriers because the government determines the benefits. So F is F, you're not tied to the network, so the carriers anymore. But the drug plans, I have a lot more people change their drug plans because they change their drugs all the time, or the plan changed with how they cover it, and they may cover it favorably this year, and next year they may cover it less favorably, and maybe another plan was covering a key drug more effectively.
So if, and you made a reference to looking through the 32 different plans. So in California, there are currently 34. 34. Okay, right. 34 Part D plans, and in a given year or switching over into the next year, if you're taking a particular prescription, that could drop off your current plan, or there may be a change in coverage around that. So going in during the open enrollment period, entering in one's drugs that or prescriptions that they're taking, they might want to make a change in plan.
The drug plan may come out with a new plan that treated your drugs very favorably. But, I'd say most people don't change, but there's always a few people that do. And statistically, most people don't even look at it, really. They sign up, and I'd probably say 90% of people don't do anything.
Okay. But it's always good to go back and check.
Right.